Welcome. My name is Dr. Ruth Shim, and I am the Luke and Grace Kim Professor in Cultural Psychiatry at the University of California, Davis School of Medicine, where I'm also the Associate Dean of Diverse and Inclusive Education. And today we are going to do a very quick recap and deep dive into structural racism and mental health. So we have to start out by defining some terms, and the terms that are most important for us to first consider are two terms that we've all heard many times before: health disparities and health inequities. So we define health disparities as differences in health status among distinct segments of the population, including differences that occur by gender, race or ethnicity, education or income, disability, or where you live. And we contrast that with the definition of health inequities, which are disparities in health that are the result of systemic, avoidable, and unjust social and economic policies and practices that create barriers to opportunity. It's really important to look at the differences between these definitions, because a lot of times when we talk about differences in health, we use the term health disparities, particularly in the United States. But what you notice about that definition of health disparities is that it doesn't tell you the cause of the difference in health. It says that there's a difference, and it says there are differences among populations, but it doesn't say anything about what is driving that difference. Whereas the health inequities term is really a much more precise definition, because it's saying that the difference is the result of systemic, avoidable, and unjust social and economic policies and practices. The reason it's really important to distinguish these things is if we do not say what the cause of a health disparity is, we tend to sometimes default to thinking that that problem lies in either that individual or that population. So we might say that maybe there's some sort of biological or hormonal difference in the population, or maybe there's something wrong with the culture or the cultural beliefs or value systems of those populations, and that's why we see these differences in health. And we do this over and over again, instead of looking to the structural level policies and practices that are unfair and unjust in our society. So we have to, in thinking about structural racism and how it impacts mental health, we have to do a little bit of a history review. And so I take you back to this painting, the signers of the Declaration of Independence, and this foundation of our society in the United States, in which these incredibly powerful words, we hold these truths to be self-evident, that all men are created equal, that they're endowed by their creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. This sentiment, which is upon which this country was founded, was really a sentiment that was founded upon a lie. Because as we can see, when the founders and the signers of the Declaration were talking about these unalienable rights, that all men are created equal. First, they were just talking about men, and in particular, they were talking about men who looked like the men in this room. So they were talking specifically about white men, and that many of the people, the white men that they believed were endowed by their creator with these unalienable rights, were men that also held and owned enslaved Black people as property. And therefore, when we think about the structures and the systems by which this country was built, we have to recognize that entire sentiment was really the foundation or the beginning of the problems in our society as it relates to thinking about the United States and health and freedom. And then we can move to about 50 years, about 80 years into the future, and we encounter a physician by the name of Dr. Samuel Cartwright. And this is a man who felt that he had a particular understanding or knowledge related to enslaved Black people, and studied enslaved Black people. And he described what he termed certain mental illnesses that enslaved Black people experienced. So one of them was this condition he called drapetomania. And he said this was the mental illness of Black people, enslaved Black people, wanting to escape slavery. And so this kind of state that he felt that people were in which was some type of mental illness. And what he said of this condition, if any one or more of them at any time are inclined to raise their heads to a level with their overseer, humanity and their own good requires that they should be punished until they fall into that submissive state which was intended for them to occupy. They have only to be kept in that state and treated like children to prevent and cure them from running away. And then the other condition he described was something he called dysesthesia ethiopica. And he said that this was the disease of rascality in enslaved Black people, or a desire not to want to work hard, or a mental illness that made enslaved Black people lazy. And he said the disease is the natural offspring of Negro liberty, the liberty to be idle, to wallow in filth, and to indulge in improper food and drinks. After the prescribed course of treatment, the slave will look grateful and thankful to the white man whose compulsory power has restored his sensation and dispelled the mist that clouded his intellect. Now, I think it's really important for us to point out that Cartwright wasn't necessarily expressing the sentiment of all physicians at the time or all psychiatrists at the time. But what he was saying was he was actually expressing a sentiment that was not only held by some people, but also has been remarkably enduring over the years. And so this idea that Black people are naturally lazy or don't want to work hard, when we are faced with kind of clear evidence to show that enslaved Black people were working at levels of productivity that were far beyond what should have been kind of natural or normal for human beings. And they were often working at these high levels of productivity in situations in which they were malnourished or had poor health issues. And yet still this really terrible stereotype that Black people are lazy and don't want to work hard has been incredibly persistent, and has and it shows how stereotypes can be remarkably enduring. So I want to cover a couple of important key concepts. The first is this idea of the social determinants of mental health. And these are the societal, environmental, and economic conditions that impact and affect mental health outcomes across various populations. These conditions are shaped by the distribution of money, power, and resources at global, national, and local levels, which are themselves influenced by policy choices. And the social determinants of health are prominently responsible for the health disparities and inequities seen both within and among populations. And so if we put it all together, we see this figure that I worked on with myself and Dr. Michael Compton, in which at the top of the figure, you see adverse mental health outcomes and mental health inequities. And one step down, as you move down the figure, you're moving further upstream. So you get to this point of risk factors. And so those include things like reduced options and poor choices and behavioral risk factors and physiologic stress and psychological stress. And we think in mental health about identifying a risk factor, intervening to prevent a bad outcome, to prevent a mental health condition, or to prevent mental health inequities. But I have come to understand that if you are intervening at the level of the risk factor, you are intervening too late, because there is context that was set prior to the development of the risk factor, and we call those things the social determinants of health. And so you see here in this, in these middle boxes, a number of social determinants of mental health, including adverse early life experiences and discrimination and low education and unemployment and homelessness and food insecurity and adverse features of the built environment and climate change. And all of those things, those social determinants of health, set the context, create the context for the development of the risk factor, and then lead to adverse mental health outcomes or mental health inequities. And so in other words, Sir Jeffrey Rose and Sir Michael Marmot call these things the causes of the causes. So the things that lead to and set the context for a risk factor. But again, as I have done this work, I've come to understand that if you're intervening at the level of the social determinant, you might still be intervening too late, because there is still context that was created even before the social determinant was developed. And that context, or what we might term the causes of the causes of the causes, are unfair and unjust distribution of opportunity, or social injustice. And what is really driving the creation of social injustice Well, two main things. The first are social norms, or our ideas in society about who is worthy of advantage of value and who is not, or who is less worthy of certain advantages in our society. And then based on those social norms, the public policies or the laws that we pass that impact and lead to a reflection of those social norms. So the interaction of social norms and public policies lead to social injustice or unfair and unjust distribution of opportunity, which then lead to a number of social determinants of mental health, which then lead to a number of risk factors and then lead to adverse mental health outcomes and mental health inequities. And then the other thing that we have to think about is how oppression is also bad for mental health. And so there are multiple types of oppression, and these are the 5 phases of oppression as described by Iris Marion Young. She talks about exploitation, which is the unequal exchange of one group's labor and energies for another group's advantage and advancement. So clearly, when we talk about slavery, that is one example of exploitation, but also we have modern day examples in our society like mass incarceration or exploitation, including warehouse workers or migrant farm workers, for example. Cultural imperialism is establishing the ruling class culture as the norm and othering those groups that are not part of the dominant culture. Powerlessness is when oppressed groups lack power and are blocked from routes to gaining power. So voter suppression is one clear example of powerlessness. Marginalization is when we expel groups from meaningful participation in society, like mass incarceration. And then violence are threats and experiences of physical and structural violence. And then to define structural racism, it is defined by the Aspen Institute as a system in which public policies, institutional practices, cultural representations, and other norms work in various, often reinforcing ways to perpetuate racial group inequity. This system identifies dimensions of our history and culture that have allowed privileges associated with whiteness and disadvantages associated with color to endure and adapt over time. It is not something that a few people or institutions choose to practice. Instead, it has been a feature of the social, economic, and political systems in which we all exist, and it does not require the actions or the intentions of others. So if we got rid of all of the interpersonal discrimination that existed in our society today, we would still see racial and ethnic inequities due to the persistence of structural racism. So I want to present a little bit of data. And this is data from SAMHSA, the Substance Abuse and Mental Health Services Administration, that showed that in 2018, 69% of Black adults and 67% of Latinx adults that had any mental illness received no treatment. And then 42% of Black adults and 44% of Latinx adults with serious mental illness received no treatment. This is conditions like schizophrenia, bipolar disorder, and major depressive disorder. And then even more concerning, 89% of Latinx adults and 88% of Black adults with substance use disorders reported receiving no treatment whatsoever. So if we think about this from that disparities, inequities frame, a lot of times when we've talked about why people don't get mental health treatment and substance use treatment, we have said that perhaps these particular populations, Black and Latinx populations, perhaps there is more stigma in these populations, perhaps there's cultural values that prevent these populations from wanting to access mental health services because they have more stigma about mental health problems. Or we might say maybe they are just not as aware of mental health problems in the way that other populations might be. But when they actually looked at the data, they found that cost was the most commonly cited reason that people did not seek care. And it was twice as often as minimizing symptoms and nearly 5 times as often as stigma. So again, it was a structural cause for why people did not seek mental health treatment. And it was a much more of a structural reason, a reason of unjust and unfair economic conditions that led to people not getting mental health care rather than minimizing symptoms or stigma. So in the time that I have left, I just want to talk a little bit about solutions. So we are in this state of an inequality where we have unequal access to opportunities. Many people think that the answer is to move towards equality, and equality is when we evenly distribute tools and assistance. Equality is really wonderful because it allows, it focuses on fairness. And some people are thinking, oh, well, we have to be, whatever we do, we have to be fair. But as you can see in this figure, if your primary concern is fairness, it will not get the job done. So equality is actually not what we should be striving for. What we need to strive for is equity. And equity is when we customize tools to identify and address the inequality. And so that's making sure you give that individual or that population exactly what they need to be successful. You give them the specific tools to be successful. And we have to couple equity with justice. And justice is when we fix the system to offer equal access to both tools and opportunities. So we have to give very specific tools to those populations that need it. And we have to work on fixing the system. And so how do we go about doing it? Well, we have to intervene on these public policies and these social norms. And so if we're going to promote social norms of inclusion and equity and respect, we have to enforce them in our society. And we have to use education or laws to change social norms. We must observe and challenge our own biases, and we need to evaluate and break down any unnecessary hierarchies. And if we're going to address public policies, we need to move beyond the walls of our clinics and our hospitals and our treatment centers, and we need to advocate for policies that address social determinants of mental health. We need to communicate with our elected officials and promote equitable representation, and we need to advocate by centering and elevating the voices of experts with lived experience. And so to end, I just want to cover a couple of important concepts. We talk a lot about power. And currently we are in a state in which a small group of people have a significant amount of power over others. And so those small group of people are able to influence and coerce others. One of the things that we need to move towards is giving power to, in which individuals are empowered and are given more ability to change their own experiences. And we also have to couple power to with power with, which is the collective power of communities and organizations. And then we have to bring together power to and power with power within, which is our individual capacities to exercise power. And so to end, I just want to say that political stances and policy interventions are required, because if you remain apolitical or neutral, that is a political stance because you are tacitly accepting the status quo. And finally, I want to say that it can be very disheartening because of recent events and the challenges that we are experiencing currently. And so we experience and have made a lot of progress over the years. We've made progress with the passage of legislation, court rulings, and other formal mechanisms that aim to promote racial equality. But it's important to remember that with progress, always there is retrenchment. And retrenchment refers to the ways in which progress is very often challenged, neutralized, or undermined in key policy arenas. And so if you're not prepared for the retrenchment that always comes when progress is made, you can get disheartened and maybe even a little bit despairing. And so I leave you with the words of Congressperson John Lewis, and he said, "Do not get lost in a sea of despair, be hopeful, be optimistic. Our struggle is not the struggle of a day, a week, a month, or a year. It is the struggle of a lifetime. Never, ever be afraid to make some noise and get in good trouble, necessary trouble." Thank you very much.